Thank you all for having me in your home today. I certainly wish that I could have been there at the marshes. It's so much that we're all going through during this time of pandemic, something we never have gone through before, and I hope this is the last time and the only time we experience this in our lifetime. My name is Dr. Kathleen Benton, and I am the President and CEO of Hospice Savannah. But I want to give you just a few minutes about my background so that possibly I'll have the credibility to be in your home today and answer your questions as we address the topic of good communication with physicians and clinicians when we go to our medical appointments. My background is in public health and ethics. I am an ethicist. I attended the School of Medicine at Case Western Reserve University and studied ethics in medicine, and from there became a clinical ethicist for St. Joseph's Candler Hospital System for 13 years. In that stage of my career, it was communication that I was truly focused on with patients and families as they unraveled very difficult situations at end of life and during treatment, where many of these could have been resolved early on if the clinician or physician and family and patient had all been on the same page and had taken the time to sit down, ask appropriate questions, and begin a dialogue and a rapport. So I know the importance of this professionally. From there, I received a doctorate in public health, where I studied all forms of quality measures in both healthcare and public health settings. So I hope from an academic standpoint, I'm able to give you some of the insight you're looking for today. Fortunately, my most important experience is from the role I played as a sibling. My brother was born when I was 5 years old with the same disease of the elephant man, and he had 110 surgeries throughout his 30 years of life and thousands of hospitalizations. Therefore, we went to Boston Children's Hospital, the National Institutes of Health, the Medical College of Georgia, Memorial, all over, from local, state, and national, even international places for medical intervention. Advocating for a patient and for the family of a patient, for the surrogate of a patient, is something that I experienced from a very early age. I have seen how disjointed and siloed healthcare settings can be for you and for your family. And so today we're going to focus on that a little bit. We all know how intimidating it can be to go to the doctor's office. That is something that most of us do not look forward to unless we happen to have an excellent relationship with the physician or clinician who we are visiting with. So I find that it's a very good time to be confident and informed and to make sure that you know what kind of conversation that you are going to have. Now, in all honesty, the books and articles that I have written regarding communication have been on the opposite side of the spectrum. I have written lots of information and done lots of research on skill of communication for the clinician. So it's very interesting for me today to be able to talk to you about how you communicate as the patient and as the caregiver with the physician. And what I find is important to note is the setting that medicine is presenting the family and patient with, and that we are then having to face. What I mean by that, we are in a world where volume is very important for the physician and the physician's livelihood. So much of the time, you only get a couple of minutes with the physician. We are in a time where the offices have lots of nurse practitioners and PAs. So some of the time you don't see the physician at all. You're instead talking with an extender for the physician. We are in a time where medicine is very disjointed. So you have lots of specialists. I would frequently say to clinicians when I would speak to them in education settings and conferences, please, above all else, do not speak to your organ. And what I meant by that, we have our cardiologist, and I would find the cardiologist would come in the room of a hospital and speak about the heart, the nephrologist about the kidneys, and the neurologist about the brain. But the reality is all of these intelligent people had gone through medical school. And what was important is that they focus on the person and how that very organ is affecting their whole body, because it becomes very confusing if we don't focus on how kidney disease may affect the heart and illness and the tests that you undergo. And it's very important that you understand this and can ask these questions and are not just referred to another specialist. We are also in a time where we may form some rapport with our primary care physician or even the specialist that is over our particular disease. For example, the pulmonologist over the COPD or the cardiologist over the congestive heart failure. But we may not see these same physicians if we are admitted to the hospital. Certainly, it is very, very unlikely we will see our primary care physician or concierge physician simply because they don't always have privileges at the hospital that we admit to, and because of this new line of hospitalist specialty. And it is usually the hospitalist who is the captain of the ship, unless you are in an intensive care unit, in which it is the intensivist who is the captain of the ship. I bring this up to you because it's important that you know who you are going to meet in your journey through healthcare as we all go through disease and progression of disease and ultimately end of life. And the best way to be prepared is to talk about it. So though I wish we could talk about it in person and you could ask subsequent questions, what I will offer is I will ask that as they film this video, they give you my contact information and my organization's contact information so that hopefully we'll be able to be some help, even if it is just answering follow-up questions. So what do I mean when I say you need to take control and be prepared for the situation when you go to your clinician or physician? Well, if you don't want to see the nurse practitioner or the PA, if you want to make sure and talk with your physician, then you need to state that before the appointment. That may mean that it takes a little longer to get your appointment, but remember that you can always talk to a person. Even though we are in an audio world where they may ask you to press 1 to confirm an appointment and 2 to cancel, you can always press 0, get somebody on the line and state your concerns. And one of those may be that during your visit, you want to see the doctor. Now, much of the time, the nurse practitioner or the PA are going to be able to do just as good of a job, but it may be important for you to hear it from your doctor. And you should be able to get that. You are the patient, you are the client, and that is your wish. So make sure you stand strong towards that. The next situation happens when you go to the physician's office. And what I feel is important for you to know is that I believe personally that it's helpful for myself, for my children, for my husband, if you're able to go to the doctor's office with someone, especially when it is not just for a routine checkup, but rather when you'll be talking about something that might be emotional or when you'll be getting some kind of news, good news or bad news. It is very difficult to process healthcare information when we are worried and scared and nervous. We may not process all that is said. So the ability to have a second set of ears, someone who is hopefully less emotional, less fearful, and more objective with you in that setting can be an absolute gift. That can be the difference between you leaving the doctor not understanding the test you have to go through and the medication you've been prescribed, to leaving the doctor with a clear head and a clear direction of what your plan of care is. So do not be intimidated by having someone with you. We actually have a program through Hospice Savannah and the Palliative Care Center offering what are called Sherpas. And these are retired physicians who accompany patients to the doctor for just this purpose. Not because the patient is not absolutely intelligent enough to understand everything. In fact, some of the people that our Sherpas accompany are well-educated doctors or professors, but they recognize there is a deficit when you are afraid, nervous, or emotional, and having someone there to be able to objectively sift through that information can help. You don't have to have them in the room the whole time. You can in fact say, I would like to bring them back for the discussion with the physician, and then just allow them to be in the room during that time. I also recommend that you go to the physician's office very prepared. One of the questions that was sent to me from one of the residents at the Marshes was how to prepare for a telehealth visit and manage a telehealth visit well. And for that, I think what is most crucial is actually this piece of advice, that before you have that visit, you actually write down a list of questions, not just brainstorm and think through what your questions would be. Because when the physician comes in, one of the things that I teach to clinicians when I do educations is that they need to sit down. It is very hard to have a conversation with someone when you are not on eye level with them, especially if they're wearing a white coat and a number of degrees, and there is an air of intimidation. So it is very rare for a clinician to sit down in any setting, in a hospital setting, or even in the doctor's office. Therefore, if they are not going to have the time or wherewithal to do that, that is again why I recommend you bring your list of questions. And you must be very purposeful about this list. I myself practice exactly what I'm recommending to you. So when I go to my doctor, I may say, can you wait just a second? I want to make sure I got all my questions answered. I may have forgotten some. And that just takes me a minute or maybe less to look through and make sure if there were any symptoms that I've been having that I did not address with my doctor, I can bring those up. A question about medication, I can bring those up. Likewise, when the doctor leaves the room, that is a good time for you to maybe make a secondary list. Other questions may come up that you want to ask the next visit, or possibly that you need to get them back in the room to ask. You never should feel concerned about calling your doctor and leaving those questions with the nurse if you don't in fact get them all answered. I think the bottom line is to always have a notepad with you, especially if you're not bringing in your own advocate. Now, this is a very difficult time in healthcare because I also recommend that same advocate in the hospital setting. And of course, that's not necessarily allowable right now, as many hospitals around the globe are not allowing visitors. So what I can say is I see how that can be very difficult. I would say the number one recommendation I would have in a time where you can have your advocate be present is to have an advocate with you at the hospital all the time. You are going to have lots of specialists in the room, even if it's just a respiratory therapist, a physical therapist, and 2 doctors. It is a lot of information overload, and there is a big possibility that you will be on medication, that you will not be able to process something because you're in the hospital in pain or with great anxiety, that you're very, very tired. And having an advocate with you to hear the doctor and hear the therapist is important. So what I would recommend during this time, if you do in fact have to be hospitalized, is that you use the very technology that is available to you today. And FaceTime in your advocate every time a different clinician, therapist, or physician comes into the room. A few minutes, a few seconds to get somebody on the line on FaceTime or even on speakerphone so that they can hear what the clinician is saying. And again, you have 2 sets of ears available to process all the information. Being a patient is one of the most vulnerable settings any of us will be in. Our bodies are exposed, we're in terrible outfits, and we are with usual strangers or people we don't have strong rapport with. So getting your confidence and setting yourself up to be able to advocate for yourself or have others be able to do this is very important. One of the questions from the Marshes was regarding the Advance Directive, a very important document that I actually came to the Marshes to speak about. This is, as an ethicist, one of my strongest areas of expertise. And again, if you have follow-up questions specific to Advance Directive, we do have the video that I made about Advance Directives, and I am open to you calling at any time to talk to you about this. The question was, when do we implement this Advance Directive? And the answer is when you are in a situation that is applicable to the information in the Advance Directive. So what I mean is, an Advance Directive is for people who are at end of life. A lot of time I hear people tell me, I don't need to worry, I'm a do not resuscitate, I have my Advance Directive. No, you're likely not a do not resuscitate, but possibly your Advance Directive and the essence of the message states that you want to be a do not resuscitate when you get to that appropriate time at end of life. Most Advance Directives specify that you are in a terminal, incurable illness or a permanent state of unconsciousness. And this is when that directive is implemented. So even if you have written in your spouse or your cousin or your neighbor as your healthcare agent, it would not be until those conditions apply to you that they would look to those folks to ask, what do you want for this person? Until then, you are the autonomous decision maker for yourself. So it's important that you have these Advance Directives on file with those you have designated your surrogate. It's also important that they're on file at the hospitals because based on the way that I have described this, the setting that you're likely going to use this in is a hospital setting or when you go under a hospice. Palliative care is the specialty care that we have brought to you at the Marshes. And the good thing about palliative care is it is a physician whose organ, like I've talked about prior to this, is pain and symptom management during illness and the art of conversation and goal setting, which is what an Advance Directive is for. So the other way to implement your Advance Directive prior to you ending up in a hospital setting is to bring on a palliative care specialist. When you do this, you can then sit down with them with your Advance Directive and say, have I gotten to that point in my disease where it's time to implement these wishes? If I don't want to go back to the hospital ever again because my disease has progressed to a certain point. Most of you are probably not to this point, but it's good to begin the discussion far in advance of this point so that you're not in an emotional situation to discuss. You've built rapport with your palliative physician and you're ready when that point comes. Guidance is always so important, just as important as the family and friend support you have during illness and disease. Extra services are truly what can make or break medical treatment and intervention. And one of those folks watching today asked the question about medical massage and medical hypnosis. Now, I am going to have to defer about medical hypnosis. I do not know anything about that. Hopefully, they will be able to find someone who knows something more about medical hypnosis and can do your next education session. I will say that we actually have a medical masseuse on staff with Stewart Center for Palliative Care and Hospice Savannah. Massage is a huge part of healing, just as big a part as music, just as big a part as nursing and the physician. And certainly we have more information about, her name is Jordan, and we can give you that information if you are interested, whomever asked that question. I know that this is a difficult time in the world, and if you are struggling with an illness during this time, it is probably even more difficult. So I just want you to know we welcome your calls. We want to give you support, and we want to allow you to be your best advocate for yourself and your family members during a hard time. The best thing you can do. The expectation is always that the healthcare world will advocate for you, but the reality is you have to advocate for yourself and your loved ones, and you need to be ready and prepared to do that. And ultimately, I think that is the message today. Now, this is a brief education, and there's so much more that we could talk about, but because we are limited in time, I, again, will just make it open to you to reach out, to give us a call, and when we're able to be together, I'd love for us to do a discussion session where we talk about what might be the impediment that you see in communication in your healthcare environment. Thank you for joining me today. Thank you for the positivity that you have for your staff and for your peers and for your loved ones you're with. I certainly understand all the stresses we're under, and my heart and my blessings and my prayers go out to you. Take care.